Hi, everyone. I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening.
Hi, I'm Deb Flashenberg, and I'm your host of Yoga, Birth, Babies. And today we're going to talk about strength training for pregnancy, birth, and beyond. This is a topic that is very near and dear to my heart because I believe that strength training can help prepare your body for birth, help you be more comfortable for pregnancy, and help you rehab postpartum. In this conversation, we're going to talk about common misconceptions about strength training in pregnancy. We'll talk about weightlifting, the do's and don'ts, safe practices, and of course, when to return to strength training postpartum, and absolutely warning signs, knowing when perhaps something is not sitting well in your body. So to have this conversation, I have Nicole Scheitlin. Let me tell you a little bit about Nicole. She is the founder of Strong Mama Wellness and a mom of two. Nicole is a certified exercise physiologist, a prenatal, postnatal fitness specialist, and a health coach with over 12 years of experience in the fitness industry. And she is the host of the Strong Mama podcast, which I had the joy of being a guest on. This conversation, I think you'll get so much out of. I think you're going to walk away feeling really empowered to exercise, to be in your body, and know that this can help prepare you for the path ahead. So I'm really excited for you to listen to that. Before we jump into my conversation with Nicole, I always like to give updates about how things are going at Prenatal Yoga Center, and they're going swimmingly. Things are really cruising along. As we start to head into the spring, we still have 7 days a week online classes, prenatal classes, and then we have in-studio classes 6 days a week. We have a full roster of childbirth prep and newborn care and lactation prep, all the workshops that can help prepare you for the path into parenthood with a matching on-demand library. We are wrapping up our school year is how I think our school year of prenatal yoga teacher training with our in-person classes, our in-person training in March and April. And then we have our final postnatal training, which I offer once a year online. So really good things happening at the studio. So I'm really excited for you to check all that out, of course, on our website, prenatalYogaCenter.com. I also have actually two asks of you. The first being, if you are someone that you think would be a great guest, I would love for you to apply to be a guest on our podcast. Or if you know somebody that you think would be a good guest, go to our website, find the podcast application, send it in. I'm always looking for interesting topics, even a topic that we've done, but maybe a different perspective. Check that out. And the other ask I have of you is when you have a moment to please leave a rating and review of the podcast because it helps other people find us. And this podcast is about supporting the community. So the bigger our community, the more support we can offer, which is really exciting. All right, we're going to take a super quick break. And when we come back, please enjoy my conversation with Nicole. Hi, Nicole. How are you?
Hey, Deb. I'm so good. How are you?
I'm doing great. I'm so excited to chat with you because I had the honor and pleasure of being a guest on your podcast. So how fun to turn it around. And now I can pick your brain. So I'm really excited. Thanks for being my guest.
Yes, thanks so much for having me. I'm honored to be here and excited to chat with your community. And your episode was fantastic. I know we have a lot of similar views on things just based on our first conversation. So I'm excited to see how this one goes as well.
Great. So let's jump in. So, we'll talk about strength training in pregnancy, birth and beyond, which is totally my jam. But before we get into the nitty gritty and I can really pick your brain, I would love to learn a little bit more about you and how did you find your way into perinatal fitness?
Yeah, absolutely. So, of course, my name is Nicole. I'm an exercise physiologist and pre and postnatal fitness specialist. My background actually started in college with an exercise science degree. So I've been in fitness for quite some time, over a decade now. I'm also a mom to two little boys. But yeah, having been in the fitness industry for quite a while, it was about... I had been in the fitness industry for about 8 years before getting pregnant with my first son, which was a little over 4 years ago now. And I just remember being so surprised with how little I knew about how to support my body with exercise in pregnancy, something that had been so familiar to me and like the back of my hand and so comfortable with it, felt scary. It felt uncertain. It wasn't just about me and my exercise goals. It was about this baby now. And I think a lot of moms that I talk to at least can relate to that and just feeling very nervous and sort of lost. And then, of course, like when I went online to look for things, you're bombarded with the conflicting information. Even the advice that I got from my provider was vague, and what I learned now is outdated. So again, it led me down this path to further my education in pre and postnatal exercise, where I learned not just how to exercise safely, which was really kind of what I wanted to get out of it. Like, how do I keep this safe? But it really taught me how to exercise in a way that would support all of the changes that my body was making and would be making in the future while preparing for birth, preparing for postpartum. So it was just this big evolution. And that's really what kept me feeling strong throughout the rest of that pregnancy, helped me endure 30 hours of labor, and what ended up being a C-section recovery, and getting back to all the things that I loved after that. So all in all, I knew that more women really needed to be empowered with exercise in this way versus, what we see online with the conflicting advice and, just the runaround sometimes and the uncertainty. So really just coming from a place of helping women feel more empowered, more confident, more, strong really, and supported throughout this journey.
So I'm curious. So with a degree in exercise science, did that cover, or during that time, did they cover perinatal exercise, or was that not really brought into your studies?
Yeah, barely at all. I would say there was about one paragraph of,
Oh, geez.
yes,
Don't lay on your belly. Was that it?
yes, it was the simplest things. I can't even remember, but it was very generic. And I was like, even as like, if I, as a fitness professional, do not know this stuff, and nobody knows it. You know what I mean? It's not, I'm not saying I know everything at all. I'm just saying like the common general population of women, we struggle with it. So yeah, very little education on
That is
that.
a little crazy. That is a little crazy. Like one of my friends is actually an OB, and she was saying that during her studies, and I don't remember what, 7, 8 years. I can't remember how long it was. They barely learned nutrition. She's like, we had the tiniest bit of nutrition, and yet their patients ask them about nutritional advice. So it's kind of bonkers that often the support of pregnant folks, it's really, it's vague, the education of it. So I'm glad
Yes.
that you took it upon yourself to learn more so that now I can pick your brain to share with our community.
Yeah.
So let's jump into, how does strength training help in pregnancy, birth, and postpartum?
Okay, so strength training is like the bread and butter, I feel, for minimizing aches and pains and just being more comfortable as your body grows and expands and changes to prepare for this baby and grow this baby, really. So, of course, strength training's purpose is to build muscle. When we lift weights or, any type of resistance on that muscle, it builds, it grows stronger. And muscles are what support and stabilize our joints, which Deb, I know you know all of this stuff, but just kind of painting the picture, because in pregnancy, we have this new hormone, relaxin, which is responsible for relaxing all of our joints. And that's great. It allows our body to grow and expand, which it needs to, but it also creates a fair amount of instability in your joints. And when your body is unstable, and that is paired with the excess weight of pregnancy bearing down on your lower half, that can become problematic and cause pelvic pain, low back pain, other symptoms like that. And so when we build strength and we build muscle, that supports the joints and it helps stabilize our joints to prevent some of those things from happening, not necessarily prevent altogether, but more or less minimize and help keep you feeling comfortable and able to do activities of your daily life. And so that's kind of the pregnancy case. If we're talking about birth, for instance, in labor, we're going to want to be moving into different positions, which requires strength. We're going to be enduring a potentially long labor. So doing the strength training in pregnancy can really like help on the mental side of things with that mental stamina as well. And then postpartum, it can also aid in a more smooth recovery and just a smoother transition to activities of daily life that a mom would be doing with their baby. So bending over a ton, picking them up off the floor, getting themselves from the floor to standing position, that all requires a lot more strength than I think we can consider from the outside looking in until we're in the moment. So all in all, that is why and how strength training can help in all of these phases.
Yeah, I want to add, first of all, I love strength training. I really kicked up strength training in my own life probably about 4 years ago. I started a course. I think it's probably similar to one that you did. I think the full title is like Prenatal, Postnatal Exercise Correctional Specialist. It's something about, I don't remember the whole title anyway, but it had so
Yeah.
much focus on strength training. And two components really stuck out with me is that so many folks, as you know, have tight pelvic floors, and that often comes from a lack of strength especially in the hips and glutes and the adductors and all that. And
Mm-hmm.
then when talking to the yoga community, where flexibility tends to be more celebrated, we also know that hypermobile bodies tend to lack strength and have tight pelvic floors. So it just made me really appreciate the need for strength. And like you said, also, those babies are heavy, like a car seat and a baby together. Like that's a lot of weight. So I just
Yeah.
want to say that I have a new appreciation for the importance of strength training. So I'm so glad that that's one of your focuses.
Yes, 100%.
So what are some of the common misconceptions about strength training in pregnancy that you run into? I feel like when I was pregnant and doing some strength training, people were like, "Oh my God, don't do that. Don't do that."
Yeah. Yes, that's exactly what comes up. And I have 3 big misconceptions that I feel are pretty common. And the first one is very much of what you just mentioned, is that the first misconception is that it's dangerous, that we shouldn't do it. And I think often we see like somebody doing CrossFit in pregnancy, which I'm not necessarily saying is right or wrong, depends on the individual. But our mind automatically just draws to the extreme and we're like, no, I'm not doing that. But in reality, it's when done with proper progressions and, you start from a foundation and build from there, it can be very safe and supportive. And actually the ACOG, American College of Obstetrics and Gynecologists, even recommends resistance training up to 3 to 4 times a week in pregnancy. So it is recommended by that big body. And so, yeah, it's dangerous is the first misconception that I would say. Have you come across that a lot too in your work?
I have. I've had some bonkers things as personally, like I've always done weights and stuff, but as I mentioned, I really got into strength training about 4 years ago. But when I was pregnant, I definitely ran into that on my personal level. And then in my classes, it's between strength and then fear of, I had a student say she wouldn't raise her arms over her head because she was told the baby would fall out. And then I was also, I know, I'm like, it would be so nice if it was that easy.
Yes.
Having some, you had 30 hours, I had 42. Like if it would have been so easy just to be like, okay, like a lever, the arms go up.
Mm-hmm.
And then I've had a lot of fear around the idea of like, I had someone refuse to twist their body at all. So I think these, like, and just like an upper back twist, not like a crazy deep twist, but I do think people get very fearful. And sometimes it's just told by a family member or a friend and they take it to heart. So kind of like the strength, or people like, don't do that. All sorts of bonker things have come through.
Yeah, it can all be hearsay, things that we hear from people and just these misconceptions that we pick up on from different places in our life. So yeah, there's no real credibility behind that one, unless your doctor specifically gives you a limitation
Right.
or you have
Correct.
a complication. So that's important to note as well. So yeah, that would be the first one. The second misconception I feel is that if you didn't lift weights prior to pregnancy, you shouldn't start now. When I say lift weights, that can really just be any type of resistance training, resistance bands, body weight training. So yeah, if you didn't lift weights prior to pregnancy, you shouldn't start now. Now, this one is also false. Any time is a great time to start. It's really just going to depend on your current fitness level. It's going to really depend on where you're starting from, where you're at in your pregnancy. So yeah, it's just really important to be mindful of starting slow. Don't just jump into joining a CrossFit gym or, jump into heavy strength training. Of course, we just really want to be mindful about where we start and how that progression goes. But there's no credibility behind that one. You can start at any point, and any time is a good time to start supporting your body with strength.
Agreed.
Yes.
And what's the third one?
Yes, the third one that I was even told by my provider in my first pregnancy that kind of led me down the rabbit hole of research was don't lift over 25 pounds in pregnancy. And this could come across in various different degrees, so to speak. So some may hear don't lift over 20 pounds, whatever that number is. Again, if you have specific limitations, definitely take those seriously. But yeah, I know pregnant people hear this one a lot, when in reality, if we think about it, by the end of pregnancy, we're going to be carrying around 25 plus pounds of weight on our body all day, every day. And so that's just a lot. That's a lot on your joints, especially when we've talked about relaxin and that extra weight and the instability. If our body is unstable, we are bound to have some aches and pains pop up, or like excessive aches and pains pop up if we're not supporting it. So yeah, there's really no science behind don't lift over 25 pounds. As we go in this conversation, we'll talk a little bit more about safety, and we'll talk about that one a little bit more in depth and how to know. But that one is also false.
I also think for those that are having maybe their second or third or fourth child, lifting the first child or like another child, maybe a child in a stroller even, is going to be more than, for most part, 25 pounds. And so daily life might get in the way of that.
Yeah, absolutely. So many second time moms, have that toddler to lift, and it's just not realistic at all. So that's another big reason to strength train, is just so you can be functional with your other kids too, if you're on your second, third, fourth child.
All right. So what are some considerations for lifting weights? Let's talk about maybe the do's and don'ts.
Yes, absolutely. So what I've kind of alluded to already is just start slowly. Start slowly, build that foundation first with very basic exercises. I, don't want to see anybody, again, jumping into intense group fitness classes, intense CrossFit classes, things like that. We really just want to build a foundation first and then add weight and intensity as you're able to. So start slow, essentially. And then another consideration we want to have is that what your body can lift or do one day might be different tomorrow. It might be different next week. Pregnancy is a wild card, and depending on sleep, depending on just what's going on in your pregnancy at a certain point, it will vary. Your energy, your strength will vary. So just something to be mindful of. It's not going to be like this clear linear thing like it could be, pre-pregnancy, when you have all the time in the world and focus and sleep and all that stuff. So I think just we have to consider that it will be different, and we will have to listen to our body, which we'll also talk about how to do that a little bit more as we go as well. And then finally, the final consideration, I think, is really to, if you can, have a plan geared towards pregnancy. try not to just go in blindly and wing it or do what you were doing pre-pregnancy. I see that a lot. And I think that there are ways we can definitely work that in. But we really want to make sure that at the end of the day, that what we're doing for our strength work, for exercise in general, is going to support the changes our body is making. It's going to support our pelvic floor and not work against that and not, put us at a greater risk for injuries, aches, pains. There's just something I learned in that certification program and continue to learn is just that everyone's body is so unique, and pregnancy, you see so many changes in such a short amount of time to your core, to your pelvic floor, to your joints. And it's amazing. And all we kind of see is that outward stuff. We see our body and belly growing. There's just so much going on internal too. And I think just having some sort of plan geared towards pregnancy is super helpful.
So kind of sticking with the idea of weights, maybe this makes no difference at all, but would you recommend somebody using the free weights, or might they have better form or guidance from the machines? Because you're literally having the machine kind of tell your body how to move instead of maybe they're compensating if they're just using free weights. I don't know if that makes sense.
Yeah, it absolutely does make sense. And I actually have a client right now who was previously used to using all machines, and we've worked her into free weights slowly but surely. I would say it depends on your comfort level, especially if you're just starting out, that if you are more comfortable with machines, start there, build up some muscle, get confident in that, and then switch over to dumbbell work, free weights, things like that. Barbells, if you really, really want to. It just depends on your interest level with what modality you use from there. But I am much more of a fan of free weight usage just because it does require your core to work. It requires, your stabilizer muscles to come into play, whereas a machine, you're fully guided, just as you said. So you're going to get a lot more bang for your buck, a lot more, I guess, functional movement when you use free weights versus machines. That's a really good question.
What about sitting during, and maybe this was just me being tired, but I used to sit on either the bench or a ball when I would do some stuff because I was tired from standing. And I also found, and I don't know if a lot of people may fall into this, I'm a very hypermobile person. So sometimes I would fall into bad lower back posture when I would stand and this just could be, I have bad posture at times and I was lazy. But I found when I was sitting on a ball, I could kind of stack my pelvis and ribs better. And I felt like I was able to stabilize a little better the bigger I got, where I just felt like there was so much forward belly.
Yeah. No, that's absolutely true. And even in pregnancy and postpartum, I'm a year and a half postpartum with my second right now. And I still notice that sort of anterior, that front pelvic tilt sometimes when I do standing exercises. So yeah, I think absolutely we can either sit on a ball to neutralize our pelvis. We can also, go into that standing position, but stagger our stance. So let's say we're doing an overhead shoulder press and you put one foot forward, one foot slightly back, and that kind of helps stack that neutral alignment, because our bodies do they naturally want to come out of alignment just with the changes of pregnancy. So definitely something to be aware of for sure.
This is such good information. Okay, we have to take a quick break, but when we come back, let's talk about the best practices for safe strength training in pregnancy. Okay, we'll be right back. Okay, we are back. So I love that we talked about some considerations for lifting weights, but what are some of the best practices for safe strength training in pregnancy? And I guess kind of an add-on to that question, is this something that you recommend someone finds a guide for, or that they can start to figure out on their own?
In terms of
what is the best practice? Yeah, of strength training. How are they figuring out what they should even be doing?
Yeah, absolutely. I think that there are a lot of online programs. There's online coaches, there are online classes. It can be really helpful to search for prenatal specific things or postnatal specific things if that's what stage you're in. So I do recommend that, especially for those who don't have an extensive exercise history. Those that do have more of an excessive exercise history may be okay to modify certain things. But I do think if you really want to, consider the physiology of what's going on and the real changes that are happening to your body and support those, I think it is beneficial to, seek out those resources that are very specific to what you're going through. So, kind of an either or situation that each person can kind of take for themselves. And also just take into account like how you learn best. Like if you feel that the accountability and one-on-one support is best, you could look for a coach. If you are more of a class goer and you like that community energy, you could seek out classes. So there are lots of different ways you can make it happen for sure.
Great. That's helpful. All right. So what are some of the best practices for safe strength training?
Okay, so for best practices for safe strength training, we really want to be, and I'm going to give a very cliche saying, but trust me, I'm going to get into it a little bit more because I hate this saying, but it's good. It's important. It's a listen to your body. I know it's cliche. So I'm going to give you some of the warning signs that you really want to look out for when you're strength training. And I think it's important to look out for these both during the workout and also after. So the next day, the next couple of days, because sometimes we could feel fine when we're in the middle. And then, the next day we notice that, we are leaking or our pelvic floor feels heavy or something like that. So, so warning signs. First one is leaking. Like if you are leaking pee, again, some of this might happen in the very late stages of pregnancy, like when you sneeze or something as the baby weighs heavy on your bladder. But if exercise is causing you to leak or, urinate, leak pee, then that's a warning sign that we want to just seek out what could be causing that and either modify or change that up. Another thing is pelvic floor heaviness. So kind of going hand in hand, if we notice a heaviness, like a bowling ball between our legs type of feeling, that's another warning sign that there's just too much downward pressure on the pelvic floor. Another one is pain. Of course, if we feel any sort of pain, that's a warning sign no matter pregnancy or not. And pain could be in your pelvic floor, pain could be in your pelvis, your low back, really anything. Another one is dizziness. So in pregnancy, we're utilizing extra glucose, like for the baby. And then we're also utilizing that glucose or blood sugar for exercise. So we could become lightheaded and dizzy as a result. And that might just require extra fueling before exercise. So eating a little snack about 30 to 60 minutes beforehand, if possible. And then the final warning sign that I have is core doming. So this is one that we don't want to see during strength training because it's just a sign that we're putting too much pressure on the abdominal wall. And core doming would really just look like a sort of bulge or a pushing out between the six-pack abdominals. And if we're noticing that for any exercise, core exercises, squats, anything you're doing in your daily life, that's just a sign that that exercise is either too much or the core is not properly engaged to withstand that load or that pressure that's going on in there. So I'll leave it at that, but that's just kind of the first thing, is just knowing your body, listening to those warning signs.
What about, and I tell this to my prenatal students, I'm curious your thoughts for weight training. What about if they find themselves holding their breath because it's so intense?
Yeah. Yes. I always try to enforce with myself and with my clients to exhale. To breathe, yes, breathe is the first step. Like just make sure you're not breath holding because yes, that can increase that pressure within the core and of course, put pressure down on the pelvic floor, put pressure out on the abdominal wall, increasing that risk of abdominal separation or diastasis recti. But breathing is the first step. And the second step here, if you've got that under control, is to try and exhale on the exertion or the hardest part of an exercise. So if we're thinking of a squat, for example, you're sitting back into that squat and inhaling on the way down. And as you come up, that's going to be the hardest part. So you are exhaling, breathing out during that part. And that sort of helps to naturally activate the pelvic floor and core to support against that pressure.
Yeah, I love that one because I felt like back when I used to go to a gym. Now I just work at my house, but back in the days when I would go to a gym, I'd often see, it was typically men, they would be like grunting and holding their breath trying to do heavier weights. And I always thought that can't be good for their pelvic floor to put all that pressure down there like that. That was my geeky brain.
Yes.
All right. These are super helpful. So can we get into some specific types of exercises? What are some best types of exercises to focus on in pregnancy?
Yes, I will try not to make this section too long. There are so many that are great.
I know. I was curious. I'm like, this could be like this could be its own podcast.
It really could. But I'll mention my favorite types and sort of examples of them and why they're so good. So I'll start with squats and hinges. So squats are pretty self-explanatory, but hinges are things like a deadlift, a good morning, anything that has us bending at the hips. So these things are really helpful to help build strong legs and glutes, which we've already covered, supports the pelvis and the pelvic floor, which helps with that function. And then plus we bend over and bend down to pick things up off the floor, pick our baby up a ton in daily life and newborn life. And so just establishing those movement patterns ahead of time is really, really supportive, can help decrease aches and pains related to pelvic and low back pain in pregnancy with the extra stress of the baby weight. So squats and hinges are amazing. Another type is a pull exercise, upper body pull. So things like bent over rows, reverse flies, pull downs, anything that's really focusing on strengthening your upper and mid back because, as pregnancy progresses, we naturally hunch over, our posture naturally evolves to that. Our chest becomes tighter, and our back needs to sort of strengthen to pull that chest open a little bit. And then even as you have a baby and toddler and you're like holding them, like the other night I was holding my 1.5-year-old while I was cooking dinner with one hand and I was holding him in the other arm and my back was super tired after that. Not only my bicep, but my back was too. So it can really just help in a variety of ways and in posture as well. Another one is unilateral lower body work. Unilateral meaning single side. So things like lunges, different lunge variations, single leg deadlifts, things that utilize one side of the body because this forces our core stabilizers to work a lot harder on the non-working side. So it not only gets that core stabilizing in, but it also isolates one side of the body, which we can create imbalances depending on how we naturally carry ourselves. And we talked about that in the episode you did on my podcast, is just how we, naturally have these imbalances just based on how we move in daily life. And so focusing on one side at a time can help to offset those. And we really need to have a balanced body in order to birth and to just feel good and comfortable, essentially. Next up is ADLs. So ADLs is an acronym for activities of daily life. And these are the things that I like to help people train for in pregnancy, like work these different exercises in that are going to mimic movements that they'll do in motherhood. So things like loaded carries. So like carrying a dumbbell on one side of your body, simulating carrying that car seat carrier. Another one I really like is a crib reach, which kind of combines, it's just as you would think about it. You're like, think about bending over a crib, extending your arms out in front of you or out and down, and picking that baby back up. So we do the same with weights. And so, yeah, just working in some activities of daily life into the strength work, really, really helpful to have a smooth transition. And then I'll wrap it up with,
I just want to say one thing. I absolutely love that, because somebody can master their deadlifts and be like, I got that form, but they may not think how it applies to picking a baby up. And if you can get your mindset around there and practice it enough, then it becomes part of someone's daily movement. Like they're just used to it. So when they actually have to do it, there's a familiarity. They're not trying to overthink or fall into bad habits. So I just want to applaud that. I love that you include that. Yay.
Yes. Yeah, it's so helpful. And I've even like felt it in my own life too, like with the example of, holding my son on one side. And so like having that static bicep hold, for instance, holding him while cooking and like stirring a pan on the stove with the other hand. And then like the ground get up is another ADL that I really like, where you're sitting on the floor and then you have to get yourself up to a standing position without using your hands. So kind of simulating, playing on the floor with your baby, and then you pick your baby up and you have to move back to standing position. Surprising how many times you do that in the newborn phase, even any time in the baby phase. So yes, all of it applies. And then the final thing that I wanted to just mention here is core and pelvic floor stability work. I think that comes into the strength category a lot, because, these two areas are significantly impacted during pregnancy. They are stretched, they are burdened, and they primarily help to support posture and decrease pain and prevent pelvic floor dysfunction. So doing those can, of course, help you have a more comfortable pregnancy, and also be kind of like prehab for postpartum recovery. I kind of consider it, if you were to have like physical therapy before going into a knee surgery, you're doing exercises to strengthen that joint so that once you have knee surgery, you can, rehab and recover so much quicker. So that's how I like to think of core and pelvic floor work, as well as, all of this stuff. So some just like simple examples would be things like bird dogs, or 360 breathing is also a good one, a simple one everybody can do. And then bridges, like glute bridges. Those are just a small sample of what you could do with core and pelvic floor, but some really good ones.
Well, that's a really good transition into talking about postpartum. So when would you recommend returning to strength training postpartum?
Yes. So first off, when you're ready, there shouldn't be any, pressure to do so before you feel like you are mentally ready. But in general, I would say after you've done some core recovery work, some like very, very much like what we had just talked about with the core and pelvic floor in that sort of first phase. I always like to see moms do some sort of recovery work to really reconnect with the core and pelvic floor and their breath before getting back into strength training. So you really want to build that very base foundation. And then no sooner than 6 weeks postpartum, of course, we want to have doctor's clearance, but take that doctor's clearance kind of with a grain of salt, not as like a full green light to go back into everything you once did. So even at that 6 week postpartum and beyond, you just want to start off, very light body weight, lightly weighted exercises, and then build on that.
I'm really glad that you touched upon the 6-week mark, because I had a student that came into class actually yesterday, and she's 7 weeks. And she said, I got the 6-week clearance. My doctor said, all is good. I can return. And she's a runner. And she said she started running, and so she was running through Central Park, she explained, and she got kind of far from her apartment. She's like, I was just peeing myself the whole time. She's like, and it's cold out, and I was far from home. And it was just, she said she was surprised. She's like, my doctor said I was fine, just pick up. And I'm like, okay, let's have a talk about that. And she was totally open to hearing. She's like, I didn't even think that I was told I could go. So I just did what I used to do. So I'm glad that you talked about it's not like magically at 6 weeks. And I think people mean well, but I really like that you said like, let's be cautious about that 6 weeks. It also depends on how someone's birth was. Like you and I
Yes.
sound like we had some challenging births. Like my body after my first birth, my pelvic floor it was trash. It was complete trash after pushing for as long as I did. Like
Yeah.
6 weeks was not a magic turning point. So I
Mm-mm.
really appreciate you highlighting that. Yes, there's clearance, but it might be a lot more and it may not. But for the most people, it's not just magically great. I can return to what I did.
Yeah, absolutely not. There's very little, at least in my experience and many here in the US experience, there's a very little evaluation done during that, appointment. And it's primarily to, I'm not knocking anybody here, but I feel like the primary thing is to like get back on birth control or
Yeah.
whatever from that appointment. But it's very rarely checking out the state of your pelvic floor and your abs. So yeah, definitely be cautious.
Yeah. And if someone can see a pelvic floor PT,
Yes.
that's just my little public
Yes.
announcement, my public service announcements. So I love that you gave some wonderful tips about or exercises for pregnancy. Do you have specific exercises you would recommend for someone first returning to work out postpartum?
Yes. So I would say it's very much a progression. We want to start with that, core and pelvic floor recovery phase. So incorporating some 360 breathing in order to really get back into reconnecting with the core and the pelvic floor. So that would be first. And then you can pair, once you have that breathing connection done, that breathing can really start days after birth if you want to. But then pairing that breathing with gentle movements like lying on your back and doing heel slides, like straightening your leg
Oh,
out,
that's one
bringing
of
it
my
back up.
favorites.
Yeah. Glute bridges, I've mentioned a few times, are good ones. Bird dogs, of course, these are all different variations and levels of, intensity and challenge. So we want to work slowly into even the core recovery work. But some of those is really what we want to be seeing in that period. Also, mobility and stretching, I think, is important to note too, because we've likely been sedentary for a little while. We're sitting a lot with a baby, I feel, feeding and holding and all of that stuff. So mobility and stretching for the hips, doing 90-90 hip switches or hip rotations can be really helpful. Runners, lunges, cat cows, anything to really just loosen up your body
Ooh,
can
let's
also
throw in
feel really
some
good.
thoracic spine twists because I was
Yes.
thinking about like sitting with the baby and how
Oh,
there's
yeah.
fatigue and the chest is just caved in and the psoas is
Yes.
like everything's just that mid upper back is just so stiff.
Oh my gosh. Yes. I love open books for that. So just lying on your side with your knees bent to about 90 degrees, knees and hips, and then taking that top arm. So your arms are extended out in front of your chest. You take that top arm and just open it up, just like you're opening a book, and then close it back up. That's so nice.
Oh, I want to do that after this conversation. Without you telling me. Oh, these
Yes.
are really such great examples. Thank you. We're going to take one more break. When we come back, what is one final tip or piece of advice you'd like to offer new and expectant parents? We'll be right back. So, what is one final tip or piece of advice you'd like to offer new and expectant parents? And you can maybe talk either from being a mom or maybe it's from being an exercise specialist. I'm very curious what you're going to come up with.
Yes. So I think this is such a good question, by the way. I think that when it comes to exercise, this is going to be more of a mindset tip and just a shift that has really helped me in that first pregnancy all the way through now, being almost 2 years postpartum with my second and still not, getting perfect sleep and just adjusting to the changes and differences in how my body feels each day. So I think the most important mindset shift that you can make is moving away from seeing exercise as a way to maintain your body or achieve an aesthetic goal and switch it to being a powerful way to support your body through the natural changes we have. I think that the fitness industry has kind of painted this picture and image that we should be using exercise to constantly change our bodies and make them smaller. But in this phase of life, I feel like it's just all about support. It's all about how you can support your body feeling more comfortable, and how, when you're in the newborn phase or beyond and you're not getting great sleep, how can you support your body and energy levels through exercise? So I think that is probably the final piece that I want to say after all this.
I love that. I feel like I have so many conversations about finding support, emotional support, getting people around you for support, but I never, I'm kind of surprised I haven't, but I've never looked at the idea of using either yoga or weight training or exercise in the physical support that you may feel more comfortable in your body, and you're literally supporting its healing. Wow. I love how you framed that. Thank you so much.
Yeah.
So where can people find your work?
Yes. Instagram is one of my favorite places to connect and share content. I'm over at Strong Mama Wellness, and Mama is MAMA. I also have a podcast, which, Deb, you were in episode 80. Everybody should definitely go check that one out. The podcast is called Strong Mama Podcast. And then anything else can be found on my website. I have a couple of freebies there. One is called Pregnancy Exercise Modifications by Trimester, really just breaking down what exercises could be changed out each trimester. And the website is strongmamawellnessco.com. So that is where you can find me.
I will make sure all of that is in the show notes. Nicole, I loved connecting with you. It was a pleasure when I got to speak with you the first time, and I feel like I got to know you even better this time. Thank you so much for sharing your wisdom.
Thanks so much, Deb, for having me. This was great.
This has been an episode of Yoga, Birth, Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.